this is your Houston chiropractor, Dr. Gregory Johnson. We have Leah here with us this afternoon, and Leah has been suffering with what probably 90% of Americans have, and that's forward head posture, which creates a ton of stress in her neck and her upper back region. She's getting headaches associated with this, and pain going out into her shoulders and into her mid-back, and overall tightness all over, from your neck all the way down. Yeah. So we're going to show you how we treat that. And she's starting to get, go ahead and turn sideways and face the mirror. You can see she's starting to get this little hump here, which is called Dowager's hump. Now that starts developing not because it's a pathological condition, but because of forward head posture, or what we call tech neck a lot of times, or text neck. And that's from people working on their cell phones, texting all the time, or on their laptops. Do you do that a lot?
Yes.
Yeah. So what that does is it creates a forward head posture, and that continued forward head posture with the bowling ball sitting on these thin 24 freely movable vertebrae creates increased stress and weight-bearing compression stress from the skull all the way down to the sacrum or the pelvis here. So we're going to show you how we deal with that. I'm going to have you close your eyes and flex your head forward and backwards with your arms relaxed. There you go. And put it where you think is normal. Now take a deep breath in. Let all of you out and just relax. Now see, when she relaxes like that and breathes normally and has her eyes closed, then her posture goes to exactly what it is. So when you're checking your own posture at home, you only do this checking in the mirror with your eyes closed, and then when you open your eyes, go ahead and open them, but don't move. You look at your posture, and if your head's forward and down, looking down this way, that means you have forward head posture, and you are likely, if you're a man or a woman, to develop this increased tissue mass here called Dowager's hump. So what we're going to do is we're going to decompress her first on the y-axis. So let's lay on this table first. And this is only Leah's second treatment too. Okay, let's lay on your back. Is this the first time I've done this one on you though?
Mm-hmm.
Yeah. So this is her very first actual spinal decompression. I know y'all like to see those. There we go, good. Now we got a bunch of crack addicts out there, Leah, that love hearing the cracking noises. Not drug addicts, but they like hearing the popping noises. So I try not to talk while I'm adjusting, but we're going to show them your very first one ever. Okay, so we bring her legs up. Now she's a little bit shorter legged than some, so we're going to bring them down a little bit because we want the legs parallel with the floor. And she has very little patellar reflex in this position right now, which means that she's got a blockage of the nerves coming out of her low back and pelvis. Get underneath your earrings. There you go. Okay, yeah. No, you're okay. So I'm going to get this around her skull and her mandible. Take a deep breath through your nose. Keep your teeth together and let all your air out. There you go. Good. Now you should have felt that all the way down, did you? Right. There you go. Good. And she didn't scream at all. And look at this. There's still not much there. I usually get a big increase in those, but that didn't happen yet, so we'll have to check her post-adjustment of her whole spine on the X, Y, and Z axes. Perfect. Good job. I see she's relaxing good on those. You feel how much easier those moved than the first time? That's because we decompressed you. When the spine over your lifetime is subject to gravitational weight-bearing compressive stress, it gets compressed, just like it sounds. Let's come over this way, sideways on your, here, yep, sideways. Bring your legs, swing your legs over, there you go. Okay, now let's go on your tummy here with your face down in here, and you can rest your arms right there. I'm going to put your head forward just a little bit there. And today's Veterans Day, by the way, so happy Veterans Day to all you veterans, men and women who have served us in the armed forces. We thank you for your service and sacrifice for our freedoms. And we celebrate Veterans Day every day here at Advanced Chiropractic Relief because we take care of a lot of veterans, and that's real sore right there, isn't it? See, her left leg was short by about 1/4 of an inch. When I brought it up, it got even, so I knew her sacroiliac was out here. And it is tender when I touch it. So is L5 right there, huh? And that's even more sore right there. Now, see, palpating her spine, just feeling with my hand, she's out right there too. Is that tender as well? And see, she's got paraspinal muscle hypertonicity on the sides of her spine all the way up and down because of that forward head posture. And this increased tissue mass up here is not pathological. It's not something that needs to be surgically corrected. It only needs to be mechanically corrected. See, right there's tender on the right. Yep, this is where your headaches start a lot of times, isn't it? Yep. See, that's tender on the right there too. So now that we have done our exam posturally as well as our spine exam on her, we'll adjust her sacroiliac joints first. And her left one's out the most. It's internally rotated and posteriorly rotated, so I'm going to adjust that a little differently on this side than I do on the right side. There. Now we're going to hit the sacrum, which is the middle triangular shaped bone, right in the middle of the pelvis. That's the very base of the spine. And if it's tilted, the rest of the spine has to compensate and adapt to that. So what we try to do is get the pelvis leveled out, and then we adjust the entire spine from the pelvis all the way up to the skull. That was L4, there's L3. And you notice the angles on my arms changing as we move up her spine, all the way to L1. And I bet you her legs are even already. Yep. And I bet you this feels a little easier than the last time already.
Yes.
Yep. Good. Okay, so I'm going to put her head down just a little bit more to open these joints up. And now just keep breathing normally for me. Okay. Just exhale. Boy, she's tight in here still. There we go. Keep breathing. There, okay. I still got one right here. I can feel it. Okay. All right, Tuffy, just exhale. There you go. Okay. Boy. She's really tight in there, so I am going to bring out the turbonator on her today. Take some deep breaths for me on this next one, Leah. It's going to be a little tight, but it'll feel better when I get done. Comments on a lot of our videos, and I know that this is a Black & Decker modified jigsaw that we had retooled by a patient of ours, and it has a great depth on it, and it's a lot of speed, so it gets way down deep into the tissues and breaks up those myofascial hypertonicities, the tightness in over the covering of the muscles, so that the muscles can bring in more oxygen and nutrition into the cells, and then also lets the blood carry out all the metabolic waste products of just everyday normal cellular metabolism. So it increases circulation, also helps the healing process. And besides that, it relaxes the muscles afterwards too. It's very painful. You did good, by the way, on that, Leah. You handled that better than most of our men do. Yeah. Okay, so now I'm going to be nice to her. This is the one most people like the best. Better than my sharp elbows or the Turbonator. As far as how it feels, functionally, I actually like getting the Turbonator done to myself, and you guys have probably seen me getting adjusted and having my chiropractor doing that on me. Now, as you can see, she's had an increased kyphosis in here, which is part of the sequela, or the complications of forward head posture. The primary curve here, the thoracic kyphosis, increases and sticks out more. That's like when you see people as they get older, they'll go from a good posture, standing up when they're young with their head up and their shoulders back like this, to, as they get older, start to walk around like Tim Conway in the Carol Burnett show. Some of you older ones will get that. Okay, so now we're going to work on her upper thoracic, right there where that Dowager's hump is. So just let me do the work. You just let your head go. Okay. Same here, just let it go on the hand. There it is. Okay, now let's turn you on your back. Okay. Now, we're going to adjust her. Just relax your legs. There you go. We're going to check her knees, and she's got good stability in her medial and lateral collateral ligaments, but we're going to decompress her from the lower end. You should have felt that in your knee and your low back, did you? Okay, good. This is an adjustment that oftentimes will take away that lower back pinch right at the base of your spine where the pelvis and low back meet. And see, when we check her leg length now, it's even, and relax your legs. And when we drop them, we should see the feet pointing pretty much the same, straight ahead like that. Hers aren't flared out or flared in. They're dropping pretty straight, which is normal. This one's flaring out a little bit, but if you remember, that's the side of the pelvis that was rotated. Okay, now, because she's got that forward head posture, her ribs are missing. I'm going to pull you down now, Leah. Just go for the ride. There you go. Okay. No extra charge for those free rides. We go like that. Okay, now, I'm going to adjust her AC joints in her shoulders. I'm going to adjust her clavicle right where it meets the sternum, and then her anterior ribs here. Now when we get done with this, she should be able to stand up straighter with her shoulders back more without even having to try to do it. Well, that one did good. And right now I'm contacting right where the ribs meet the sternum. Okay, let's sit you up here and face towards Renee now. There we go. Yep. Straight that way, yeah. Look straight ahead for me. You feel that little clicking in your shoulder there? Yeah. That's her glenohumeral joint. There we go. Okay. This one's not as much. There it is. Good. Okay, and then we're going to adjust her right elbow. Good. Her right wrist, thumbs, index finger, middle finger, ring finger, and little finger. Good. Then we're going to do the same thing with the left elbow. Relax it. Okay. Excellent. And it's really important for the patient just to breathe normally while we're doing this and not hold their breath. Okay, good. Let's come over here in front of the mirror again now, Leah. And I'm going to have you stand in front of the mirror again with your feet shoulder width apart. And I'm going to have you flex your head forward and then backwards again. And remember how this feels. back all the way, and then back to normal. Okay, so already we're seeing her hands are more at her sides rather than being out in front of her. Take a look. So you're not so far forward now. You're a little bit to the right still. So her homework is she's going to lift up with her traps. She's going to pull back simultaneously with her rhomboids. Flaring these hands out like this, palms forward. Do you see how it tightens up this entire trapezius muscle? Now, you might want to spread your feet a little bit further apart. So because you're a little forward and to the right, we're going to do exactly a mirror image of that. We're going to go straight back and straight to the left, just like that. And now lift your chin up towards the ceiling. You're going to feel a little tap right there. Another little tap right there. And now relax. And try that same thing again now. Forward all the way and then backward all the way. Much straighter. Okay, now take a look at her side posture. You can see that has gone down. Do you see that? It's not as sticking out as much. So our Dowager Hump's going to get better when we get her head up and back over her shoulders properly. Do you feel like you're standing up straighter without having to try? Good. All right. So did that reduce your neck pain and headache?
Yes.
Okay, good. Leah, would you mind sharing with our YouTube subscribers how you came to find us and how you've done so far? This is only your 4th treatment, so.
Right. Well, I found you guys on the internet, seen your website, and you had some videos, so that was really helpful.
Okay.
So that really made me want to come because you did a good job in the video.
Oh, thank you.
So this is why.
Well, you probably watched Renee's first too, huh?
Right. So this is why I'm here. And
okay, thank you very much. And do you feel like you've improved so far in these first 4 sessions?
yes.
Okay.
Yes,
Do you feel better when you leave here than when you walked in the door?
I do.
Okay, good. Well, thank you for sharing your story with us.
Thank you.
And happy Veterans Day to you from Houston, Texas at Advanced Chiropractic Relief. This is your Houston chiropractor, Dr. Gregory Johnson. We'll see you next time.